Have you ever noticed that your vision sometimes feels as if it is becoming cloudy or hazy? Not all the time, but periodically, almost in waves. At certain moments, you may notice it when looking into the distance, and at other times when trying to focus on objects up close. Objects begin to lose clarity. Edges are no longer sharp. Headlights from oncoming cars may appear blurred, scattered, or even doubled. Colors seem different, less vivid, less bright, sometimes taking on a yellowish tone. The optical system of the eye changes over time, and most people naturally try to find a simple explanation for these changes. Many assume this is just a normal part of aging. Others believe it is caused by eye strain from prolonged use of computers, smartphones, or other digital screens. It feels logical to think that the eyes are simply tired. People often hope that rest will solve the problem. They assume that better sleep, fewer screens, or taking short breaks will restore their vision. And sometimes these changes do seem to fluctuate, reinforcing the idea that the issue is temporary. However, not all visual changes are reversible or harmless. In many cases, the symptoms described can be early signs of cataract. A cataract is a condition in which the natural lens of the eye gradually becomes cloudy. It is not an infection, not an inflammation, and not a temporary disturbance. It is a structural change in the transparent lens that plays a critical role in vision. The lens, known as the crystalline lens, is located inside the eye, just behind the iris. Under normal conditions, it is completely transparent and flexible. Its primary function is to bend and focus light precisely onto the retina, allowing us to see clearly. In youth, the lens is highly elastic. It easily changes its shape, becoming thicker or flatter depending on whether we are focusing on near or distant objects. This process happens automatically, without conscious effort. This ability is called accommodation. Thanks to accommodation, we can read, work with small details, and then instantly shift our focus to distant objects. We rarely think about how complex this process is because it works effortlessly. But over time, the structure of the lens begins to change. It gradually becomes denser and less elastic. Eventually, it starts to lose its transparency. Cloudy areas form within the lens. These areas may differ in size, density, and location. At first, the changes can be very subtle, which is why many people adapt to them without realizing that a disease process has begun. Cataract does not develop suddenly. It is usually a slow, progressive condition that evolves over years. This gradual progression allows people to compensate and adjust, often delaying medical evaluation. It is important to understand that cataract does not have a single, universal symptom. Its manifestations can vary significantly from person to person. The most common sign is a gradual decrease in visual sharpness and quality. But visual quality is not limited to reading letters on an eye chart. It also includes contrast sensitivity, color perception, and the ability to see clearly in different lighting conditions. Some people notice that they see worse in bright sunlight, but relatively better at dusk. Others experience the opposite: poor vision in low light environments and difficulty seeing at night. These differences depend largely on where the clouding is located within the lens. When the opacity is located in the central part of the lens, bright light causes the pupil to constrict. Light then passes directly through the cloudy area, reducing image clarity. In dim lighting, the pupil dilates, allowing light to bypass the central opacity, creating a temporary illusion of improved vision. However, this improvement is deceptive. The underlying condition continues to progress regardless of lighting conditions. Another common symptom of cataract is the appearance of double or multiple images. A person may look at a single light source and perceive two or more images. Streetlights and headlights may appear surrounded by halos or rainbow-like rings. This symptom is not exclusive to cataract and can occur in other eye conditions. However, it is frequently associated with lens clouding and often becomes more noticeable over time. A very typical complaint involves glasses. People may feel dissatisfied with their current prescription, even if it was recently updated. They may notice that their glasses no longer provide clear vision, regardless of how often they clean the lenses. Some individuals find themselves changing glasses frequently, searching for better clarity. Yet, despite adjustments, the quality of vision never fully returns to what it once was. There is also a particularly misleading symptom that often delays diagnosis. In some cases, people suddenly notice that they can see better up close without glasses. They may be able to read small print or perform fine tasks and assume their vision has improved. In reality, this is not a positive sign. It indicates that the lens has become denser and its refractive power has changed. This can lead to a form of induced nearsightedness. Distance vision gradually worsens, but this change may go unnoticed for a long time. Especially in older individuals, distance vision may not seem as important as near vision, allowing the condition to progress silently. As a result, visits to an eye specialist are often postponed. Meanwhile, the cataract continues to develop. It is important to understand that cataract can develop at any age. Although it is most commonly associated with aging, this does not mean that cataract is exclusively a condition of the elderly. Cataract can appear in middle age, in young adults, and even in children. In younger patients, it is often related to congenital factors, eye injuries, inflammatory processes, metabolic disorders, or systemic diseases affecting the body as a whole. In some cases, cataract develops after trauma to the eye or as a result of long-standing internal imbalances. For this reason, age alone should never be used to rule out cataract. Whenever visual symptoms appear, the condition of the lens should be evaluated regardless of how old a person is. Diagnosing cataract does not require rare or highly complex equipment. There is a common misconception that cataract can only be detected using advanced or expensive machines. In reality, lens transparency can be assessed during a standard eye examination using a slit lamp. This is basic diagnostic equipment that is part of the standard setup in any ophthalmology office. During this examination, the specialist can clearly see the structure of the lens, evaluate its transparency, and determine the location and density of any clouding. As a result, cataract can be identified early and accurately without complicated procedures. When a person is told that they have cataract, anxiety is a natural reaction. The word itself often whispered fear of vision loss, surgery, and uncertainty about the future. From a medical perspective, however, cataract is a condition with a well-established and effective treatment pathway. Despite this, many patients are not ready to consider surgical treatment immediately. Instead, they begin searching for alternatives. They look for eye drops, exercises, vitamins, or non-surgical methods that promise to improve or reverse cataract. If someone searches online for cataract treatment without surgery, they will find countless articles and recommendations. This abundance of information can create the impression that cataract can be treated conservatively. However, it is essential to understand one fundamental fact. There is no medical or non-surgical treatment that can eliminate cataract. Eye drops, ointments, supplements, and exercises cannot restore the transparency of the natural lens. They do not reverse the structural changes that occur within the lens tissue. At best, they may provide a psychological sense of action, the feeling that something is being done. In some cases, people believe their vision has temporarily improved. This can be due to changes in lighting conditions, focusing effort, or natural adaptation. In other situations, cataract may progress slowly, creating the illusion that a chosen method is effective. But the underlying process continues. the clouding of the lens does not stop. The second key truth about cataract is that it always progresses. The only uncertainty is how fast this progression will occur. The rate of progression varies from person to person and depends on several factors, including metabolic activity, the presence of systemic diseases, individual anatomical characteristics of the eye, overall health status. A very common mistake is waiting for the cataract to mature. Many people believe surgery should only be done when vision becomes extremely poor. This approach is outdated and no longer supported by modern ophthalmology. An early or immature cataract is not a reason to delay treatment. In many cases, timely intervention can prevent complications and allow for faster visual recovery. As the cataract progresses, the lens becomes denser and harder. The denser the lens, the more technically demanding the surgical procedure becomes. This may increase stress on the internal structures of the eye and prolong the recovery period. For this reason, recommendations to avoid unnecessary delay are based on clear medical reasoning. The only effective treatment for cataract is surgical replacement of the clouded lens. During surgery, the natural lens is removed and replaced with an artificial intraocular lens. Modern artificial lenses are made from high-quality, biocompatible materials. They are designed for long-term use and do not become cloudy over time. In most cases, they do not need to be replaced again. The choice of lens is individualized. It depends on the anatomy of the eye, visual needs, and specific optical parameters. The final visual outcome depends not only on the lens itself, but also on accurate positioning and proper surgical technique. Many patients ask about what is commonly referred to as secondary cataract. It is important to clarify that this is not a recurrence of the original disease. During cataract surgery, the contents of the natural lens are removed, but its thin outer obolochka, known as the capsule, is preserved. The artificial lens is placed inside this capsule. Over time, the capsule may become cloudy due to natural cellular changes. This condition is called posterior capsule opacification, often referred to as secondary cataract. It can cause gradual blurring of vision, similar to the original symptoms. However, it is a harmless and easily treatable condition. Restoring clarity in such cases is done with a quick laser procedure. The treatment takes only seconds, does not involve incisions, and requires minimal recovery time. After the procedure, vision typically returns to the level achieved shortly after surgery. It is important to note that the development of secondary cataract is not caused by poor quality lenses or surgical errors. It is an individual biological response, more commonly seen in younger patients with more active cellular regeneration. In conclusion, cataract is a common and well-studied condition. It can develop at any age and present with a wide range of symptoms. The greatest risk associated with cataract is not the disease itself, but delayed diagnosis and prolonged avoidance of appropriate treatment. Timely eye examinations, accurate diagnosis, and evidence-based treatment allow people to maintain good vision and quality of life. The earlier cataract is identified, the safer and more predictable the path to visual restoration. Take care of your vision and do not ignore changes in how you see the world.